Dopamine D2 antagonist. Prochlorperazine for Meniere's disease side effects. Common. Anticholinergic effects. Drowsiness, hypotension rare. EPSC, akathisia, tardive dyskinesias, acute dystonic reactions involving involuntary contractions of muscles. MOA of cynarizine and dimenhydrinate to treat vertigo. Cynarizine inhibits histamine H1 and H4 receptors and dopamine D2 receptors. Cynarizine also blocks voltage-gated calcium channels. The primary mode of action for cynarizine is a vestibular system depressant through inhibition of calcium ions into vestibular hair cells. Damage to vestibular hair cells and their innervating neurons causes vertigo. Dopamine D2 antagonism may suppress vomiting at the CTZ. However, this is considered secondary mode of action. Dimenhydrinate inhibits histamine H1 receptors and has anticholinergic activity. Its anti-emetic and anti-vertigo effects come from its antimuscarinic activity. Mechanism for secondary mode of action of prochlorperazine in suppression of vomiting. D2 inhibition acting at CTZ to suppress vomiting. Beta-histine side effects headache, nausea, dyspepsia taken with food to reduce GI adverse effects. 3. Receptors that prochlorperazine binds to. M1 receptors, H1 receptors, D2 receptors at these receptors. Is it an agonist, antagonist, or inverse agonist? M1 is antagonist, H1 is antagonist, D2 is antagonist. MOA of beta-histine into the 3 most important steps. It is a potent vasodilator. It reduces endolymphatic hydrops pressure predominantly through a vasodilatory effect. It improves blood flow to the labyrinth and permeability of endolymphatic fluid drop in pressure. Is beta-histine an agonist, inverse agonist, agonist at postsynaptic H1, inverse agonist at presynaptic H3, antagonist at H4 histamine analog to treat vertigo and side effects beta-histine. Headache, nausea, dyspepsia, GI adverse effects drug class of armodafinil and modafinil. And what is it used for? Non-amphetamine psychostimulants commonly used for narcolepsy, also used for shift work sleep disorder. Z-drug, zolpidem and zopiclone indicated to treat what? And MOA, to treat sleep disorders. It enhances the inhibitory effects of GABA. It binds to a site in a pocket created by the alpha and gamma subunits of the GABA receptor. Their binding causes a conformation change in the chloride ion channel, increasing the frequency of its opening, leading to accumulation of chloride in the cell, hyperpolarizing it and reducing its activity. Zolpidem has more rapid onset. Zopiclone has longer duration, 5-7 hours. Methylphenidate, indicated to treat ADHD. Benzodiazepine overdose can be reversed. What drug is used to treat this? Flumazenil, which is antagonist of benzodiazepines, and Z-drugs at GABA, a receptor antihistamines are inverse agonist at H1 receptor in the hypothalamus. Why first-generation antihistamines like diphenhydramine and doxylamine are more sedating than the second-generation antihistamines? First-generation antihistamines can cross blood-brain barrier due to their lipophilic nature. It causes sedation, and second-generation antihistamines are less lipophilic and therefore much less sedating. E is daytime sedation, dizziness, impaired cognition, delirium, anticholinergic effects, paradoxical agitation. Orexins are neuropeptides that help to regulate sleep by promoting wakefulness. Orexin receptor antagonists, such as suvorexant and lemborexant, act as competitive antagonists at the orexin 1 and orexin 2 receptors to suppress wakefulness maintenance, thereby promoting. It enhances REM and NREM sleep. Zolpidem causes diarrhea. Zopiclone causes taste disturbance, dry mouth, drowsiness. MOA of doxylamine and diphenhydramine. First-gen antihistamines. Antihistamines are inverse agonists. They bind to the H1 receptor, preventing excitation of wake-promoting neurons, leading to a feeling of drowsiness. Modafinil and armodafinil side effects to history of psychiatric disorders. History of psychosis. Depression or mania increases the risk of psychiatric adverse effects. People with a history of substance misuse are a higher risk of abusing these. Common AE, nausea, diarrhea, dry mouth, headache, anxiety, depression, nervousness, dizziness, palpitation, hypertension. The Z drugs, zopiclone and zolpidem, both have adverse effect of impaired alertness. This adverse effect is dose-dependent and can occur the next morning. Adverse effects with amphetamines like dexamphetamine, lisdexamfetamine are dose-dependent: nausea, loss of appetite, weight loss, diarrhea, dry mouth, anxiety, irritability, aggression, insomnia, tachycardia, palpitations. BP changes. MOA of benzodiazepines like alprazolam, diazepam, bromazepam, clobazam, flunitrazepam, lorazepam, nitrazepam, oxazepam, temazepam for anxiety. It enhances inhibitory effects of a BAIT, acts at the GABA, a receptor, a ligand-gated chloride ion channel, which is comprised of 5 glycoprotein subunits. It binds to a site in a pocket created by the alpha and gamma subunits of the GABA, a receptor. It facilitates binding of GABA to the GABA, a receptor, and causes a conformation change in chloride ion channel, increasing the frequency of its opening, leading to accumulation of chloride in the cell, hyperpolarizing it, and reducing its activity. AE is drowsiness, oversedation, hypersalivation, slurred speech, vision impairment, lightheadedness. MOA of melatonin to assist with sleep disorders. Melatonin is hormone that is secreted by the pineal gland and an agonist that binds to MT1 and MT2, G protein-coupled receptors in the SC and part of the anterior hypothalamus. Binding to MT1 receptors promotes the onset of sleep. Binding to MT2 receptors shifts the timing of the circadian rhythm. It potentially improves sleep onset latency, quality of sleep, and delayed sleep phase syndrome. AE, back pain, joint pain. Individual benzodiazepines. Duration of action. Diazepam for anxiety, long-acting, less than 24 hours due to active metabolites and long half-life. Midazolam for procedural sedation, preoperative sedation, short-acting 1 to 3 hours. Temazepam for insomnia, short-acting 6 to 12 hours. We should not consume alcohol while taking temazepam. For all benzodiazepines, alcohol has an agonist-like action at GABA, a benzodiazepine chloride ion channel. Significant risk of additive adverse effects.